Today, everyone recognizes the symbolic meaning of the pink ribbon and its importance to breast cancer activism. The Komen Race for the Cure events and other similar organizations receive prominent attention in all sectors of society. Additionally, today, public figures that are diagnosed with breast cancer are expected to go public with their diagnosis and progress with little expectation of political backlash or criticism. Notably, during the recent politically decisive 2012 presidential election, Ann Romney discussed her breast cancer diagnosis and recovery with next to no political response or backlash and received wide and understanding support. In an age where popular breast cancer activism across college campuses and communities is often taken for granted, how did such support become so widespread in the political, social, and personal spheres? Specifically, how did Betty Ford, a prominent political figure and former First Lady, in addition to being a breast cancer survivor, change the nature of breast cancer awareness during the 1970s? A period of immense change. More generally, how did Ford change the way in which society perceived the disease, and how did she change the doctor-patient relationship? Analyzing First Lady Betty Ford's 1974 public declaration of her breast cancer diagnosis and its response from both the scientific and public community provides insight into this vague and complex question. Ford noted in a Time magazine article in response to her diagnosis, "When other women have the same operation, it doesn't make any headlines. But the fact that I was the wife of the president put it in headlines and brought before the public this particular experience I was going through. It made a lot of women realize that it could happen to them. I'm sure I've helped at least one person, maybe more." In the midst of President Richard Nixon's war on cancer, the sexual revolution and the second wave of feminism, and the birth of the breast cancer memoir, the early 1970s are a crucial time period to understand breast cancer. The National Cancer Act reads, "The director shall collect, analyze, and disseminate information useful in the preservation, diagnosis, and treatment of cancer, including the establishment of an international cancer research databank." It is crucial to understand that surgery was professionalized and established during this time period. This was initially done by William Halsted, a 19th century American surgeon. Halsted favored the radical mastectomy, a breast cancer surgery that was practiced until the 1980s. Furthermore, this practice was heavily criticized during Ford's time. Additionally, there is a growing faith in the medical community, compounded by the American Cancer Society, which was made up of surgeons in one of the most powerful medical organizations, and their acceptance of radical surgery. Finally, the use of war imagery in the public's attempts to cure cancer, in addition to the Cold War context, caused many doctors to feel the need to operate more. Specifically, a diagnosis of breast cancer created a more intimate and significant relationship with multiple specialist doctors. These doctors were held in higher esteem than traditional family doctors. While much has been written about the public response to Ford, specifically understanding the often contentious relationship between doctors and patients provides an increased contextualized understanding of her influence, as well as the development of breast cancer as a whole, which is prevalent in all Americans' lives. No comprehensive understanding of breast cancer or disease is complete without considering both the scientific and public responses. Throughout the 1970s, many vital decisions, such as the war on cancer, were based in part on an attempt to change the scientific community and how it interacted with the public. This is despite many historians' emphasis only on the public response to scientific developments. It is necessary to shift this emphasis and broaden understanding of public figures' influence on breast cancer. Specifically in the war on cancer, there is an attempt to strike against what was perceived as doctors' complete dominance over the patient. This was based on President Nixon and his administration's belief that the scientific community had become arrogant and insular. Nixon stated that he wanted the scientific community to, quote, "shape up" in regards to cancer. While today many are concerned with the lack of doctors' opinions in the public sphere due to the internet and the polarization of scientific ideas, many activist movements, such as the Lasker Foundation, which was one of the first successful organizations to raise money and awareness for cancer and health issues in the early 20th century, as well as the war on cancer, were started in part on the distaste for doctors' arrogant and uninformative interactions with the public. More people were confident in their diagnosis thanks to Betty Ford, and could engage in a meaningful conversation with their doctor. Betty Ford embodied this change, as even one of her doctors noted in a public statement, Mrs. Ford asked intelligent questions. Yet doctors did not respond to this change in patient attitudes. Therefore, it is important to note that Ford's doctor, in the same public statement, was primarily happy that while Ford asked intelligent questions, she accepted all of his advice. It was not until Bernard Fisher, a cancer researcher, in his analysis of breast cancer surgeries in the late 1970s that the ever more controversial practice of radical mastectomies became extinct. Even Fisher's test results were initially marginalized until he had acquired enough data to overwhelmingly prove his point to influence the mainstream practices in powerful societies that supported radical surgeries. This demonstrates important themes in the history of science, including the disconnects between patient and doctors, the doctors reluctant to include patient responses and attitude in their beliefs, instead relying on a biased burden of proof that is often too high. Ford emphasized the human element needed in scientific interactions, as well as the necessity to analyze all sides of an issue rather than purely relying on a burden of proof based on arrogance. Atul Gawande, a modern-day surgeon and science writer, emphasizes this humanness by noting, "We rarely see how medicine actually works. It's not science you call upon, but a doctor with good days and bad days, a doctor with three other patients to see and, inevitably, gaps in what he knows and skills he's still trying to learn." Ford helped the public realize that the way they needed to interact with doctors needed to change, and that doctors, who were not connected intimately with the public, were not the ones who would initiate that change. While today Ford is known for her work in drug and alcohol abuse clinics, her influence on breast cancer activism had an even greater influence both during and after her time in the White House. Furthermore, it was rare for women to publicly declare their breast cancer, then a taboo subject due to its high mortality rate and treatment methods. So when Ford declared her breast cancer diagnosis in 1974, she altered the role of how public figures were expected to act, which extends today to figures such as Ann Romney and Teresa Heinz Kerry, politician John Kerry's spouse. Specifically, she advanced the role of the First Lady by maintaining a separate and complete identity. This was important, since many at the time seemed to only have an identity through their husbands. Additionally, as a woman, she was a role model who helped other women struggling with then taboo subjects such as breast cancer gain a sense of solidarity and the understanding that they were not alone. This was especially important during the second wave feminist movement and sexual revolution, which broadened the range of debate surrounding women's issues to include, among other things, cancer. Although Ford did not see herself as a feminist specifically, during this time women looked to other women for support and leadership, and Ford saw it as her duty to provide it. After Ford took her cancer public, she received over 50,000 letters of support from other women facing breast cancer in the United States. For example, one letter simply stated, "Thank you, Betty. Sincerely, the nation." Betty Ford's pronouncement coincided and influenced the rise of the breast cancer memoir from activists such as Rose Kushner, celebrities such as Shirley Temple Black, and important figures such as Betty Rowland, an NBC News correspondent. Through these memoirs, women began to gain a greater sense of self-responsibility for their cancer. At the same time, this self-responsibility was coupled with a sense of community and the sharing of information between friends, relatives, doctors, and the public. It helped to change the disease from a personal and inward struggle, which was how the disease was perceived at the time. It became a disease that involved everyone and that couldn't and should be fought externally as well as internally. While the war on cancer helped to shape breast cancer as a national external struggle, Betty Ford helped to shape it as an external struggle on the personal level. It was this legacy that Ford left that caused even those such as Rose Kushner, a feminist and breast cancer activist, who disagreed with how Ford handled her breast cancer, to respect her. This demonstrates that her influence extends beyond just her immediate actions. Rather, it is her ideas and philosophies which truly have an influence today.